increasing industrialization, India is not immune to man-made disasters like accident in a nuclear reactor or chemical power plant. Unsafe disposal of a hazardous material like radionuclide can lead to radiation emergency. Example is radiation incident of Mayapuri. Poisoning of river in Kerala, where a dealer in pesticides, while closing his business, dumped about 400 kg of pesticide in Rayoram river, which is near Kozhikode. We got a call in NDMA, and then an expert team from National Disaster Response Force and DRDO was sent over to manage and to neutralize this. You all know chemical leak in the form of chlorine in Mumbai, which has recently happened because of unsafe storage. These are the certain events which happened very recently. There is a great possibility of potential threat of CBRN terrorism, specifically during Commonwealth Games. A terrorist may use a dirty bomb, which on explosion causes the widespread contamination and hazardous effect on body. Mainly they use either a nuclear substance in the form of cesium-136, 37 and cobalt-60. These are having very long half-life, maybe more than 8 years or so. So once these radionuclide goes inside the body, they cause long-term effect in the form of cancer, cataract, premature aging, genetic damage and infertility. Similarly, the various biological agents which cannot be undermined, they have a great potential, easy to produce, cheap, and very small amount is required to play havoc. As little as 1 gram of botulinum toxin can kill about 10,000 people. Management of disaster in chemical, biological, radiological scenario poses a great challenge. Because of contamination, rescue worker has to put on protective clothing in the form of gloves, boot, face mask, which reduces working efficiency. In addition to that, protection, detection, decontamination, antidote administration, decorporations are certain extra special steps which one has to do for management of CBRN casualty, in addition whatever usual care we do for the blast and heat injuries. Therefore, the certain specialized facilities are to be created in the hospitals, which are earmarked for NBC filter-fitted ward, biowaste disposal facilities, creation of bone marrow centers, radiobiodosimetry, decorporation agents, growth factors, vaccines, antidotes, etc. In Mayapur incidents, there was bone marrow depression of all these victims, and they were having drop in platelets count, which you know is there also in case of dengue and how serious it is. All of you are knowing it, and fall in neutrophil. These cases were treated by an expert team of NDMA, All Institute and Army Hospital under the guidance of General Bhardwaj, Honorable Member NDMA. We saved out of 8 patients, 7 were treated and 1 we could not save. Other cases who did not have symptoms but they were exposed, about 45, their radiobiodosimetry was done at INMAS DRDO, and those patients are being followed up. So this incident is a wake-up call that we must strengthen our CBRN casualty management facilities. Keeping that in mind, under the chairmanship of General Bhardwaj, the infrastructure, non-structural and capacity building planning has been done for the large hospitals who are earmarked for the CBRN casualty management. General Bhardwaj is the main force behind these courses which are being done. Not only that, he is getting done the mock drills so that it can be implemented at ground. The DRD Gwalior is supporting this course in a big way. Team of scientists led by Dr. Bir Singh has come here and they have mobilized equipment for demonstration of CBRN equipments. Dr. B. Singh and Director DRD, they have deputed one of the technical officer, Mr. Kaul here, who is here for last 2 weeks to make this course a success. JPN Apex Trauma Center is hosting this course and giving all support. Dr. Amit Gupta has got a special interest in CBRN and they have created state-of-the-art facilities for the medical care of Commonwealth Games where specifically the CBRN casualty management facility is also being created. Government of Delhi is supporting this course. The presence of Dr. Bhattacharya, Director of Health Services, is very encouraging. Dr. D. Bhattacharya, CMO, is working hard to make this a success. During this course, we are going to discuss how to handle casualties at the site of incidents, and after decontamination, resuscitation, how to be carried in an ambulance. That is also very, very important. So far, whatever ambulance had been in the country, they had just a stretcher, but now with medical preparedness and mass casualty management national guidelines which have been prepared under the chairmanship of General Bhagwas, we are getting created facilities that these ambulances must be fitted with the defibrillator, ventilator, oxygen cylinders and IV facilities. Once we stabilize the patient, that need to be continued till the time they reach to hospital, and the hospital, of course, how it has to be treated and treated. All the doctors will be told how to use the protective equipment, how to use the detection equipment, how to do the decontamination. At the same time, it will also be taught that safety of rescue worker is of utmost importance in any chemical or a nuclear environment. A radiation dose when rescue worker receives up to 5 rats, then he can work for 2 to 3 weeks. If it is between 5 to 25 rats, he can work only for say 4 to 5 days. And if radiation exposure dose which one is going to receive very high radiation is more than 50, then one can only work for a day, and in no condition a pregnant woman will be allowed to participate or to work in such a scenario. Radionuclides, once they go inside, then they are in the body for quite some time. They have to be removed as early as possible. For that, there are certain drugs which are known as decorporation agents. How they are to be used, what are those drugs, will also be discussed during the course. As far as the chemical scenario management is concerned, our emphasis will be that how quickly one can detect a type of chemical so that the individual can be given antidotes and immediately treatment can be given. At the same time, any extra second of a chemical agent is detrimental. It has to be removed as fast as possible. Therefore, the decontamination is also very, very important. Regarding the biological agents, all doctors, they know how to treat infective disease. Biological agent, they call the infective disease in the epidemic or pandemic proportion. However, the biosafety, biosecurity of biological material, virulent biological material, planning for the quarantine and isolation facilities, vaccine stockpiling of drugs, etc. will also be discussed during this course. The anthrax is the most commonly likely used to be of this biological agent because it is in the powder forms and can sustain for quite some time. Planning has been done for vaccination for the anthrax also for the people who are at high risk. So, I am sure that this course will be very useful for the doctors to manage CBRN casualties. In the end, I will appeal to all the doctors to put their best effort to learn from this course. Thank you very much.